yet another special episode of ETHealthWorld Health TV. We have very important guest joining us today. It's none other than Dr. Basant Garg, the additional CEO of NHA. Thanks a lot for taking out time with ETHealthWorld, sir. To begin with, I would like to ask about Ayushman Bharat Pradhan Mantri Jan Arogya Yojana happens to be one of the few schemes in the country which is 100% data driven and analytics oriented from day one of implementation. So in regards to PMJ, how is India building a strong capability in digital health?
This is the 5th year of the implementation of Ayushman Bharat PMJ. And you are right, a lot of citizens are availing benefits under the scheme, and we have a huge amount of data. But let me, at the very outset say that data is very secure and it is with the government, and at no point of time, any agency or any organization is able to view this data. Regarding your question regarding the, Ayushman Bharat digital mission, how we are trying to leverage the digital capability and how we are trying to create this ecosystem. The Ayushman Bharat digital mission is we are working on creating all the enablers for a robust digital health ecosystem. We are creating the digital public goods, the Ayushman Bharat Health Account, which is the citizens registry. We are creating a registry for the healthcare professionals and a registry for healthcare facilities. Now, using these registries and having these unique identifiers, we intend to create services built in over these digital public goods. And of course, once we are able to do that, we'll be able to uniquely identify all the stakeholders of the health ecosystem in order to create trust and to prevent fraud. And even within PMJ, we feel that there are a lot of synergies between the digital mission and the Ayushman Bharat PMJ scheme as such.
So one more question, since you said it's 5 years of journey, what kind of changes you have implemented, like in 5 years of journey, if you can just say the pinnacles of it, like if you can just...
Right. So for the Ayushman Bharat PMJ scheme, we have been now able to bring in identify the beneficiaries, which has been very important aspect of the scheme. And in addition to that, we are now also able to introduce, better health benefit packages. We are able to empanel more hospitals. So all the stakeholders are now able to increasingly participate in the scheme and also contribute to the evolution of the scheme. In addition, we have integrated Ayushman Bharat PMJ with the digital mission. So we are using not only the PMJ ID, we are also using the ABHA ID along with the PMJ ID. So that helps any citizen to access his records, which are now available at the fingertips of the citizen. Their records, health records, which are with the PMJ scheme. And in addition, we have also introduced some revolutionary changes, like we have introduced the green channel payment system for trusted hospitals, wherein a hospital which is having a good track record and where no frauds are detected, that hospital can claim 50% of the claim amount upfront. Now that's a huge facility for a hospital to be able to do that. In addition, we are also having a robust anti-fraud mechanism at NHA, which has been developed in-house with the support of our NHA team as well as our vendors. And using that anti-fraud mechanism, we are able to identify cases totally using AI and ML, artificial intelligence and machine learning. We are able to mark cases, identify cases as suspicious. Now these suspicious cases are moved to the state to then adjudicate whether they are actually a fraud or whether they are all right. Now within that category, for each of these triggers, it is not any human being who's checking those claims. It is all triggered by machines, and rule-based triggers are there. There are AI triggers also, and these triggers allow us to send across a large number of cases as suspicious. Then the state anti-fraud teams, they are able to conduct even a field audit, and then these cases are classified as fraud or not fraud. And based on this, NHA, that goes on to reject those claims. a major change has also happened here, that earlier we were first paying the claims, and then if a claim is identified as a fraud, we were recovering that as a penalty.
Yeah.
We have moved away from this system. Now this fraud analytics happens before the payment. So which means a suspicious claim does not get paid, and so there is nothing to recover. In a way, now we are preventing fraud. So that has been the evolution on the anti-fraud thing. And similarly, in other fields also, our packages have improved. Our health benefit packages, they have evolved over time. So as on date, the health benefit package of 2022, that has 1949 procedures, and at very good rates, which are largely accepted across all specialties. 27 specialties are there for which these 1949 procedures have been mapped. So that is how the scheme is evolving. For the beneficiary, we have moved. For the citizen, we have moved away from the web portal based approach to a mobile app. So the beneficiary has greater access to his information to check his eligibility. So that makes it a better experience for the beneficiary, and that has also led to greater utilization by the beneficiary of the scheme. Another important thing which we have done is we have gone in for card drive. Earlier PMJ was not envisioned as a scheme wherein a physical card would be required, because it is all IT driven. But we realized that card is a very empowering thing for a beneficiary, because there is there's a asymmetry of power between a private hospital and a poor patient. And in order to address this asymmetry, it is very important that the beneficiary or the patient gets a physical card, which he can go to then he can go to the hospital and present it as a symbol of his entitlement. So this empowering feature we identified, and we have gone for extensive card drive across the country. And as on date, 23.3 crore cards have been created for the citizens, and that has led to greater utilization of the scheme. So that has been another feature which the journey of PMJ has seen. Another important aspect which we have seen is that using the NHA IT platform, states are now feeling increasingly empowered to go on to the universal health coverage. So PMJ, when it started, it was envisioned to address the secondary and tertiary healthcare needs of the bottom 40%, the poorest 40% of India's population. But now states are becoming more and more confident. They are happy with the efficiency of the scheme, with the delivery of the scheme. Now states are going beyond 40% and adding more and more beneficiaries. There are at least 10 states and UTs which have gone beyond 40% and even gone to the extent of universal health coverage. So that is a very encouraging thing for PMJ, wherein states are now ready to go beyond 40%, and beyond 40% states are ready to bear the complete burden, financial burden of these beneficiaries. So this is another thing how the scheme has matured over time.
Dr. Garg, you have mentioned about the anti-fraud mechanism in detail already, but I would like to also know about, at a time of increased cyber attacks, like one which had actually happened in AIMS, so on healthcare institutions like this. So is digitization is like in healthcare is trickier than any other segments? You feel that it has to be always constantly like updated and supervised, and what kind of digital hygiene is maintained as more like medical records are being digitized by NHA? It's like a lengthy and continuous process for you.
Right. So again, this question relates to our digital mission. And regarding cyber attacks, let me tell you, cyber attacks, they happened in the past, they will keep happening. The Ayushman Bharat digital mission does not introduce any additional vulnerability in our systems or in the data as it flows today. With the Ayushman Bharat digital mission, due to our federated data architecture, the data stays where it is stored today. So we are not bringing any data to any central server or to any government cloud or anywhere. So the digital mission itself does not introduce any increased vulnerability to cyber attacks. Yes, but cyber attacks happen, and there are agencies, there are ways to fight those attacks and to prevent those attacks. And of course, we always have those, we go through security audits and all the processes to check and to stamp out these vulnerabilities. our basic principle is privacy by design and security by design. We are not asking the citizen for any information which is not required. So only those data fields are asked for and captured which are required for a health record. And I don't think health is in particular is in any way more vulnerable to these cyber attacks. I think much more critical and vulnerable would be financial uh, information and data. But as we know, a lot of financial transactions are happening, a large number of UPI transactions are happening. So I don't think it is the digital which brings in cyber attacks. It is, we have to be careful about identifying these vulnerabilities, getting our security audits right, and that would prevent these attacks. And let me also add that the attack of which happened on AIMS has nothing to do with the digital mission. So let me please set it right.
Yeah. Can you tell us about the purpose of designing a curriculum on digital health for MBBS students? Very curious to know about it. From the student side also, there's a lot of curiosity on this.
So at NHA, we are approaching this issue of having some exposure to MBBS students to digital health. And we are designing, MBBS students get a flavor of public health programs, during their social and preventive medicine curriculum. We intend to incorporate a specific module or a chapter on the Ayushman Bharat digital mission. And we are taking steps towards that. This is one part of the job wherein MBBS students will be exposed to digital mission and digital health. But also, in addition, we also feel there is a need for specialized courses. Like, you may have a MSc in digital health. So for that, we are also designing specific curriculum, and we will go through the proper channels. Maybe we'll go through UGC or through specific specialized institutions who can run these programs. So we are looking at all those options. One is, of course, exposing all students, all MBBS students to digital health. That is one approach. And the second approach is having a specialized course, a master's degree or a course in digital health.
So this will be like implemented in, like, it will take how many years or something?
No, I certainly it's not a question of years, but we are trying to, bring all the stakeholders together, get our, job right, because the curriculum has to be made through a wider consultation. And then, of course, there are processes to be followed before any such course is instituted and offered to the public. And then, of course, the overall curriculum we are designing.
Okay. So, going further, I would like to ask about ABTM introducing the scan and share service for OPD patients. I think it's a hit in Karnataka.
Yes.
Right. So, which has benefited over maybe 5 lakh patients. Correct me if I'm wrong, since it's implementation. So, could we see similar services being implemented for other case scenarios? How it is?
Right. So when I said that we are building these digital public goods under the digital mission, the goods are just, the public goods are something with, it's a basically digital infrastructure. Based on this infrastructure, we'll be able to provide use cases, services, and the scan and share, as you have rightly said, is one such use case. It is a faster way of OPD registration for patients. Generally, we see, in public hospitals, patients have to stand in long queues for a considerable number of hours to avail a simple OPD registration. What we have done is using ABHA as the identifier, and using ABHA, we are allowing demographic data of the patient, the name, address, age, all these things to be automatically transported to the OPD registration computer, thereby reducing time as well as reducing errors. And we have found that using this use case, patients are able to save time from 55 minutes to about 4 minutes. So that is a considerable saving of time, and patient journey becomes easier. Till date, more than 700 hospitals across India, they are using scan and share, and 25 lakh patients, they have used this, and they've saved their time. So we have been able to demonstrate how digital health and how digital transactions will reduce time and bring in efficiency. Of course, there are other use cases now, other ways in which we feel the patient journey in a hospital can be reduced, the time can be saved. And for that, we are also exploring scan and share based, laboratory testing and laboratory test information sharing, and also scan and share based payment interface. So we are also developing that, so that we found that after OPD registration, one of the pain points for the patient is when he has to go for a laboratory test, where again there is a long queue, and then there is a long queue at the time of payments.
Yeah.
So all these pain points we are trying to address. Other than these, we are also trying to develop different use cases around, addressing the problem of the long time taken for claim settlement. So we are coming out with a health claims exchange. Already we have put it on the sandbox, wherein people, the providers, the hospitals, as well as payers, the insurers, they can come and test their software. So very soon we feel that we'll be able to roll out the health claims exchange. And also for enabling interoperability of services, we have developed the unified health interface, which will improve discoverability of health service providers like doctors, for laboratories, to a large number of patients. Today, the problem for a patient to discover the health service providers around him is that you have to be on the same platform to be able to discover these health service providers. Whereas UHI, a person on one platform will be able to discover and search for facilities across platforms. So we are moving from the platform-centric approach to a network-centric approach. This is pretty much what UPI did to the financial transaction world. We feel that UHI will make a difference to the health services. And we can again build in more and more services on the UHI platform also. And UHI again is ready for testing, and we are, as of today, more than 10 integrators, more than 10 people they have come both on the public side and the private side, and they are testing this already.
So what plans are in the works with stakeholders to maximize the impact of ABTM? If you could talk about it.
I think one of the biggest challenges for us today is how to increase the adoption of the digital mission. There is a large, there's a huge public sector wherein national health programs run by the government are there, and then there are state programs. We have a large number of health and wellness centers in the public space. But then there is also an equally large private space wherein we have large hospitals, single doctor clinics, nursing homes, clinics, smaller clinics, and we have a large number of laboratories. So all these stakeholders have to, finally come to digital way of providing healthcare services. And I think adoption is one challenge which we are presently trying to address. We have got a lot of support from the public sector, large government programs such as NCD, RCH, NICSHE. They are all onboarding to the ABDM. They are modifying their softwares in a way that digital health is possible through them. But in the private side, we feel that it is pretty much fragmented. There are a large number of HMIS solutions available, and different hospitals are using different kind of solutions. And we are, having a more a kind of a conciliatory approach, or a more accommodative approach when it comes to these software companies. We are trying to encourage them to enable their softwares on as per ABDM guidelines. We are also trying to encourage hospitals and insurers to ask for ABHA, to ask the citizen and to encourage the citizen to get for getting registered on ABHA. So I think adoption is a challenge which is still going. We are grappling with. But let me also tell you, even today, as we speak, more than 40 crore Indians, they have ABHA account, which means out of 40 crore out of 140 crore. So that's a considerable number of people. But we feel that, for the digital mission to achieve a critical mass, it should be in excess of 100 crore. So I think as soon as we reach 100 crore, our large number of people will have their ABHA account, and they will be able to avail services, and the demand for these services, not only the supply, but the demand will go up. We have around 2 lakh health facilities which are registered with us, another 1.8 lakh doctors which are registered with us. But we are making efforts to increase the number of people on all the registries. And also, of course, we are trying to develop more and more use cases to encourage adoption.
And also, we heard that will the NHA be appointing ABDM mission directors for every state? Is this coming in? How it's going to contribute like the NHM mission directors? It's going to be like similar one?
Right. So on that front, already NHA has and the government of India has asked the state governments. Already, state governments have appointed state MDs. So state mission directors are in place. Generally, a middle seniority level, IAS officer or an officer from the state is heading that mission. We under the digital mission, we have also asked the states to set up their PMU.
Okay.
Right. So as of now, most of the states, they are in the process of setting up their PMUs because the digital mission is going to go on for a considerable time. The states are faced with a choice of giving most of the job of the digital mission as an additional charge, but that is not sustainable.
Okay.
So we are encouraging the states to set up separate PMUs so that there are dedicated people for this job and the people who understand the job.
So they'll be only doing the work of ABDM and
yes, we are encouraging states to appoint separate SMDs as far as the leadership is concerned, and we are also encouraging states to set up separate PMUs.
Okay. So just wanted to wrap up with one final question, like the immediate milestones which you are like thinking of in maybe a year or so that you would like to achieve in NHA, like what are the immediate milestones?
Right. So a year is a very long time in digital. I think we would like to actually hit the critical mass as far as Ayushman Bharat Health Account (ABHA) is concerned. So we would like to cross 100 crores.
Okay.
To achieve that kind of a critical mass, we would like to maybe cross 15 lakhs for the healthcare professionals and 15 lakhs for the healthcare facilities. I think that would be a minimum. And within this, I think we would also like to have 100% coverage of public sector facilities and public sector doctors. We feel that is easier to go ahead with. Other than this, we also plan to bring out more and more use cases, some of which I have already mentioned. And we will also want to develop more use cases. So populating the registries is one part, and of course developing more and more use cases for citizens to experience a digital way of receiving health services. So that is our second main objective. I think we would really like to achieve these within a period of this year.
Thanks a lot. Thanks for the time, Dr. Garg.
Thank you.